Welcome back to our health channel, where we bring you valuable information to help you take charge of your well-being. Today, we'll be diving into the topic of cardioversion, a medical procedure designed to restore a regular heart rhythm. Cardioversion is a medical procedure that can be a game-changer for individuals with certain irregular heartbeats, also known as arrhythmias. It's often used to treat conditions like atrial fibrillation, where the heart's electrical signals go haywire, causing the heart to beat irregularly. So, why would someone need cardioversion? Well, it's typically recommended if you have a heart rhythm disorder, such as atrial fibrillation or atrial flutter. These conditions occur when the electrical signals in the heart's upper chambers don't travel properly, leading to a fast or irregular heartbeat. There are two main types of cardioversion: electric cardioversion and chemical cardioversion. Electric cardioversion: this involves the use of a machine and electrodes to deliver quick, low-energy shocks to the chest. It allows healthcare providers to instantly check if a normal heartbeat is restored. Chemical, pharmacological cardioversion: instead of shocks, this method uses medications to restore the heart's rhythm. It takes longer to work than electric cardioversion but can be an alternative if your provider recommends it. Like any medical procedure, cardioversion has potential risks, but they are relatively uncommon. One concern is the possibility of dislodged blood clots. Some individuals with irregular heartbeats may have blood clots in the heart, and cardioversion could cause these clots to move, potentially leading to life-threatening complications like strokes. To minimize this risk, healthcare providers may order tests to check for blood clots before performing cardioversion. In some cases, patients may receive blood thinners prior to the procedure. Another rare risk is developing other irregular heartbeats during or after cardioversion. If this occurs, it's usually within minutes of the procedure, and medications or additional shocks can be given to correct the rhythm. After cardioversion, you'll spend about an hour in a recovery room, closely monitored for potential complications. If electric cardioversion was a scheduled procedure, you can typically go home the same day, but you'll need someone to drive you. Be aware that your ability to make decisions may be affected for several hours. These heart-healthy changes include limiting or avoiding alcohol, reducing salt intake, choosing whole grains and lean meats, limiting sugar and unhealthy fats, increasing physical activity, maintaining a healthy weight, quitting smoking, and managing stress and anger. In conclusion, cardioversion is a valuable medical procedure that can help individuals with irregular heart rhythms regain their normal heartbeats. If you or a loved one is facing the possibility of cardioversion, remember that it's crucial to discuss your specific situation with your healthcare provider to determine the best course of action. That's it for today's video. Thank you for tuning in. Remember to subscribe to our channel for more informative content on health and wellness. Stay healthy, stay informed, and take care.